Hi everyone, Adam here. Today I'm here to talk to you about carpal tunnel syndrome. So carpal tunnel syndrome is when you get tingling, pins and needles, pain, numbness into the hands just past the wrist. So going up into this part of the hand, usually into the palm of the hand, but it can be on the other side. These symptoms are caused by compression or pressure onto the nerve, the median nerve that goes through the carpal tunnel at the front of the wrist. So what is the carpal tunnel? So the carpal tunnel sits at the front of the wrist, so on the palm side of the wrist, and it essentially describes this area around your wrist. So this area around the wrist is made up of mostly bones underneath that form a U shape like this. And they're the bones, they're the small bones in your hand. They make up this U part of the wrist. And what happens is you've also got a ligament over the top that forms this tunnel around here, and that's called the carpal tunnel that sits around here. And travelling through that tunnel is all the tendons for these muscles in the hand and wrist, and also one nerve known as the median nerve. So that nerve innervates the muscles, it supplies the muscles with the messages to contract. It also supplies the skin so that you can have sensation on the skin, and it also supplies the sensory nerve, so it experiences pain and sends those signals back up to the brain. Now, the pain that you experience and those symptoms that you experience is caused by pressure on that median nerve. Now, that pressure can be caused by a whole host of different things. Either a fracture to one of the bones in the wrist that causes a bit of inflammation of one of those tendons. If you've got inflammation, it tends to swell a little bit, and there's not a lot of extra room in that carpal tunnel, so it causes pressure on the other structures, one of them being the median nerve. It can also be caused by other things like fluid retention, and amongst other things. You're more at risk of developing carpal tunnel if you have a few other factors. Unfortunately, ladies are more susceptible to it than men. You're also more susceptible to it if you have brittle bones, so something like osteoporosis, because then that's more likely to cause a fracture and a bit of swelling. If you have some sort of inflammatory disorder, so rheumatoid arthritis or sometimes osteoarthritis are quite common causes of carpal tunnel, because again they cause inflammation around the joints in the bones in the hand. You can also have an increased chance of it if you're pregnant as well, because you get or have lymphedema, because then you get some fluid retention, and that can cause extra pressure because you get a bit of swelling around there. I think the most common one, as well as those, is if you're diabetic, because if you're type 2 diabetic in particular and it's not very well controlled, that can cause what's called a peripheral neuropathy, which is a fancy way of saying that essentially the nerves that are peripheral towards the hands and the feet generally become attacked by the diabetes because of a poor blood supply to them, and that causes them to have a bit of inflammation and can cause this tingling, numbness and pain as well. So if you have carpal tunnel and you want to treat it from a physio point of view, there's a couple of things that we will look at. So one of the main treatments is from an exercise point of view that have sort of two or three main focuses. One of them being if it's caused by a tendinitis or an inflammation of one of the tendons in the wrist, then we'll look at wrist-based strengthening or loading exercises, because that'll stimulate blood flow to them and get a bit of healing in that tendinitis. And if we settle that down, then there'll be less pressure on that median nerve. One of the other options would be wrist mobility type exercises, stretching that area out. If it is that's causing the problem and you have a lack of mobility in the wrist, then that's something you can look at. The other one, or probably one of the first things that I'd give more for comfort rather than anything, is a wrist splint. So in the UK we call it a cock-up splint, because you strap it to your forearm like this, and what it does is it has a metal bar that goes across this part of the wrist, and it cocks your wrist up just in a slight extension position like this. And what that does is that just opens up the carpal tunnel a little bit and just takes the pressure off of those tendons and that median nerve. So it's usually for comfort mostly, but also if you're taking the pressure off of it, it will give you a bit of chance and a bit of room to breathe, and just allow it to settle a little bit so you're not aggravating it the whole time. Other exercises we can look at are more nerve-related exercises, so you can do what are called nerve glider exercises. So they generally look at the path that the nerve travels from the neck all the way down the arm into the fingers, and trying to mobilise that nerve to stimulate a bit of blood flow to it. If the exercises do fail, or it doesn't get any better after a given time, or if the symptoms are just really severe, you can consider other options. Sometimes you can have a steroid injection into the wrist. It's not particularly comfortable at the time, but it can really help settle down that chronic inflammation in there if it's really not budging. And some people often have surgery for it, especially if it's, say for example, build-up of scar tissue from like a repetitive strain injury over years and years of use of the wrist. Then that's the most appropriate option, and if you have surgery, then it's pretty routine over here in the UK. Now, with carpal tunnel syndrome, the best thing that you can do for it is try and prevent it in the first place, and there's a few ways of doing that. First, you need to consider what you do for work and what you do on a daily basis, and how much you use your hands. Unfortunately, if you use your hands more often, you're more likely to develop this carpal tunnel, so you might have to adapt what you do on a daily basis. So think about if there is anything you can change at work that means that you don't have to work so much with your hands on a daily basis. Whether you can try and split the workload between you and other people that work with it around you as well, so you're not all doing the same task every day. Have a bit of a varied workload and varied tasks that you have to do in the day. Another thing to consider would be your work setup if you work at a desk. So if you're at a desk and you're working at a computer, you need to either be taking regular breaks to take the pressure off your wrists from typing, or you may need to change your keyboard and mouse just to make sure you're not in that wrist extension position for long periods of time. Because if you're sitting there typing, you're putting pressure on this area, and it can be up to 7, 8, 9, 10 hours a day, maybe even more. And that repeat pressure on there, and then also using those muscles over and over and over again, might cause a bit of inflammation in there, and again cause that carpal tunnel syndrome in there. Another thing to consider would be your posture as well. So the main thing that we look at is how you're holding your upper body, and especially if you're at work, you see a lot of people that sit at a desk and they tend to round their shoulders over time and tend to lean forwards towards the screen as the day goes on. And what happens in regards to carpal tunnel, it's more other things that could affect it. So from a wrist point of view, your upper body posture won't really change too much, but what it does do is if you're in this sort of position looking at the screen with very hunched shoulders, it puts pressure on where the nerves come out of the neck. And the nerves come out of the neck, they go down the arm and into the wrist and then into the hand. So you might be causing a bit of pressure on them, not only here, but also adding to it from putting pressure on from around the neck. So if you can have a bit of better posture, less pressure on those nerves, and it's just going to ease what's going on around the wrist. So how long does carpal tunnel syndrome take to get better? And that really varies, again, more on the treatment option that you have. So if you're looking at surgery, it'll be a pretty structured rehab program afterwards, so it'll be more of a rehab protocol. So it'll be dependent on what you want to get back to doing, but a pretty set period of time. Doesn't really vary unless there was any complications on there. If you are still in physio and you're going through more of a conservative management of it, it depends what you do on a daily basis. If you're working at the desk again and you haven't made those adaptations that we went through, those demands or that pressure on the nerves and the wrist will be that much higher, so we've got to meet those demands. So we've got to look at mobility, we've got to make sure that the pressure's taken off the nerves. Maybe we might even need to use the splints for a bit longer, because at work it puts you in a position or at night it puts you in a position that takes the pressure off of the nerves. So it was very individual, and that's more where the appointments come in. The problem is usually pretty much the same per person, different levels of severity, but it's more to do with that individual situation and how we can apply that to that person. If it is more of a tendinitis that's causing the problem, generally with the exercises, if they're at the right level to start with, you should start to see some improvements around the 6-week mark. But it can take longer. Generally, to see some improvements at 6 weeks to sometimes even 3 months, but some people are better even sooner. So there's that individual variation, but also depends on where your endpoint is, what demand you're putting it under on a daily basis. If you found this video useful, if you did, please leave a like and subscribe, and let me know in the comments if there's anything else that you wanted from this video that I didn't include, or if there's anything you want me to do in the future. I do read the comments, and I really want to have some feedback as to what else you guys want to see and what you want to hear about. All right, thank you very much, and I'll see you in the next video.